Good evening, everyone, and welcome to our urgent Protect Our Province COVID-19 briefing for Alberta on Wednesday, September 15th, 2021. This unplanned broadcast is live streaming from the traditional and ancestral territory of many peoples. We are grateful to live and work in Alberta, a province on the traditional territory of 48 different First Nations and the unceded homeland of the Métis Nation. Today's important messaging is being shared in ASL. To ensure access to completely accurate information, closed captioning will be uploaded after the live stream is complete. This conversation for the public is being shared live on YouTube, Twitter, and Facebook. We are hopeful that this will increase the accessibility of our briefings for all Albertans. Since we began these briefings, we have promised Albertans a regular panel of doctors and experts who endeavour to bring timely, accurate updates on the COVID-19 crisis in Alberta, and that is why we are here today. We will be sharing our broadcast on long COVID tomorrow, but for the moment, we must address what the Government of Alberta announced this afternoon. Today's briefing will aim to be 15 minutes in length to increase Albertans' access to information around the horrendous tsunami the Delta wave is creating in our province. Good evening, everyone. With me today, I have Dr. Schwartz, Dr. Asadi, Dr. Bakshi, Dr. Gasparovich, Dr. Lee, Dr. Parks, Dr. Keegan, Sarah Mackey, and Dr. Zaidi, members of the Protect Our Province Alberta team. Each of them will make a brief statement to help Albertans explore some of what was said today. We will begin with Dr. Keegan.
Hello. Tonight, Premier Kenney said that COVID-19 was not predictable. This is false. Dr. Gasparovich and multiple other scientists projected the exact scenario that we are in right now, and the government ignored them.
If we are implementing a vaccine passport or a province-wide restrictions exemption program, if that's what we're calling it, it absolutely must be accompanied by a widespread, wide-reaching vaccine campaign to address the enormous equity issues around vaccination. We need outreach teams deployed to areas with low vaccination rates and high mistrust of the vaccine. And we need experts working with trusted community leaders in those areas to combat misinformation, address hesitancy, and help them understand the gravity of the situation their community is in. We need actual, practical, immediate action to address barriers to vaccination to accompany these vaccine passports. We need targeted, specific efforts that address the many diverse and nuanced reasons that Albertans are not vaccinated.
We have been talking about this for some time, that the restrictions were lifted prematurely. They should have accompanied social distancing and mask. So what's happening today is sad, but we had predicted so and told the Premier and the Medical Officer of Health. And instead of saying that they're just sorry, they should be accountable for their miscalculations or opening the province prematurely, knowing that this would happen. So we are doing our best we can. Thank you.
COVID is both predictable and preventable. It can be prevented, and it can be predicted months ahead, and it can be prevented. There are jurisdictions that have a perfect pandemic response, which is Atlantic Canada, among others, and New Zealand. I'm really happy that the government finally treats this COVID crisis seriously. So it's a good step forward. But I'm afraid that these measures might be not strong enough to bend the curve immediately, and we need to bend the curve immediately to stop the disaster that is happening.
I'm just deeply saddened about having to be in this position again. And I don't understand why it took so long for the leadership of this province to acknowledge the mounting crisis in the health system and the realities of COVID.
One gaping hole for me from today's press conference is that we didn't hear them explicitly address spread in schools. Bringing in provincial masking for grade 4 to 12 will mitigate transmission. That was needed. But masking should be extended from kindergarten to grade 3. We need to have contact tracing reinstated in schools. Didn't hear that on the announcement. 2 weeks in, there are at least 40 schools on 10% or greater absenteeism due to respiratory illness. And that's just what has been communicated to us, so there could be more. Today, there were 389 new cases in children. We're hitting records again for youth infections. Right now, if parents get an exposure notice, which are few and far in between, there's no guidance being offered from public health. So why not offer rapid testing in schools as a follow-up option if there is exposure? So the leadership say they want to mitigate the effect on children, but they're continuing to ignore spread in schools will force schools to close again as a result of letting Delta spread widely in crowded classrooms. The role of government is to lead, and instead of them being ahead on health and safety of students, we're always pulling them to catch up.
So I need to say that our healthcare system's in a desperate state right now, and we absolutely need every Albertan to get on board and to do their part. As frontline healthcare workers, we go to work every day with the hope that we can help out Albertans, and I think at this point in time, it's very clear from our healthcare leaders across the province that we're going to need Albertans help us to do their part, help us so we can help them. I'm going to need some time to digest what was implemented today to see if it's going to be enough, if the proposals will be enough. But I really think I need to say this, that if Albertans don't pitch in and if they don't work together and continue good behaviors or change bad behaviors, then thousands of Albertans are going to needlessly suffer and many will die. So people need to get vaccinated, they need to wear masks, they need to avoid large crowds. And honestly, it sounds trite, but we all have to work together to break this vicious cycle. And we'll be there on the front lines to see you when you get sick. But I just want to make it clear that all healthcare workers right now are going to need every Albertan's help.
So with today's announcement, Jason Kenney has demonstrated himself to be a skilled contortionist, bending himself virtually into a pretzel in order to appease a small, fringe but vocal group of individuals who are opposed to vaccination. As a result, we're left with a hodgepodge of measures that are confusing and consequently they're likely ineffectual. Dr. Yu has made clear to Albertans that we are not far from implementing a triage protocol, which aims to move decisions of who lives and who dies away from doctors and to pre-specified objective measures. What that means is really we are in an extremely dire state. We are in big trouble. And this is time for strong leadership, not half measures.
Today's announcements, I will be the first to say that I was very confused. Much like my colleagues, there was a lot of information to digest. And so whether or not these restrictions and these public health measures are going to be enough remains to be seen. But one thing that we all can agree on is that they are late in coming. Our healthcare system, as said by Dr. Yu, is in dire straits. We are in positions that none of us have ever been in before. We are faced every day with the fear of having to implement triage or make tough decisions. My hope is that every Albertan listening to this, that listened to the presser, can make the choice to help healthcare workers, to help us help you. We don't know if these measures are going to be enough, but I fear that we are already past the area that we need help in. I fear the next few weeks in Alberta are going to still be very, very concerning, and we are going to see needless suffering and deaths due to the lack of inaction.
Experts express the same thing. I think that the next 24 to 48 hours are going to be a lot of unpacking for every single Albertan, regardless of how you intersect with healthcare, regardless of how it intersects with your specific work situation. We all are going to need to take some time to reflect on how we can help ensure that the healthcare system that we all depend on manages to stay as intact as possible over the next few weeks. COVID is airborne. Wear the best mask available to you. If you haven't been vaccinated, please sign up, call 811, or go to your local pharmacy. It's going to be a long month and a bit, no matter which way you look at it. Be careful with yourselves. Be safe with those you love. And we will be back again on Friday. And over the next 24 hours, keep an eye on all of these wonderful humans' Twitter feeds as they unpack some of what has happened today and can think around what some of our next steps and best options should be. Thank you, Alberta.